So for this lesson, we're going to be looking at inheritance of traits, and we're looking at pedigrees and genetic disorders. So basically, a pedigree is going to be a family history that shows how traits are inherited over several generations. So basically, pedigrees are usually going to be used when parents want to know if they are carriers of a particular disorder. So what they're going to do is they're going to look at their family history, look at their grandparents, look at their grandparents, and see kind of trends in how certain disorders are being passed down. And then from there, determine, are they a carrier of a particular disorder? Okay, so when you're making a pedigree, there's going to be certain symbols that you want to follow. Every time you have a circle, it's going to mean that it's a female. And every time that you have a square, it's going to be a male. The line that joins the two together, male and female, is going to indicate a married couple. And then coming off of that line, those branches are going to represent the offsprings or the children of this particular family. All right, so these are going to be all of the siblings. All right, so this is an example of a pedigree. We're going to have our grandparents are on both sides. So of the people that have come together. So what happens a lot of times is that you'll have a couple and they're looking at having children, and they want to figure out what are the chances of their children having a particular disorder. So they'll look at a pedigree, figure out if they're carriers of this gene or of this allele or this disorder, and then determine the probability that their children are going to have this particular disorder. All right, so here we have the grandparents, and we're trying to figure out if does any disorders run in this families. So what can you tell from pedigree? So whether a family has a autosomal or sex-linked disorder. So basically, when you're going to look at this pedigree, and you're going to determine if it's a dominant disorder, a recessive disorder, or a sex-linked disorder. So if it is a dominant disorder, you're going to see this in every generation. If it is a recessive disorder, you're going to see it's going to kind of skip generations. All right. And then if it's a sex-linked disorder, it's only going to be in males, or it's only going to be in females. Okay, so let's take a look at this pedigree, and I want you to tell me if it's autosomal or sex-linked. And then I want you to tell me if it's dominant or recessive. So I'll give you guys a second to figure that out. All right, so if we take a look at the colored blocks means that they have this disorder. Okay, so if it's colored in or shaded in, that means that they have it. So this disorder, is it in every generation? No, it's not in every generation. Okay, and then if you're looking at, because it's not going to be in every generation, so it's going to be recessive. And then we want to figure out if it's going to be sex-linked or if it's going to be autosomal. And for this one, because it's going to only be in males, this one is going to be a sex-linked trait. All right, looking at this example, this is going to be a autosomal dominant disorder because it's going to be in every generation. All right, so here, generation 2, generation 3. Okay, and then it's not going to be sex-linked, so that's why it's going to be autosomal. This one, it's not going to be in every generation, so it's going to be recessive. And then it's also going to be autosomal because it's going to be equal in both males and females. All right, so looking at color blindness, okay, so these are genetic disorders that are common genetic disorders. So we have color blindness, sickle cell anemia, cystic fibrosis, hemophilia, and then Huntington's disease. All right, color blindness. So basically, it's going to deficiency in the ability to perceive colors. So it's a problem with sensing pigments in certain nerve cells of the eye. About 1 in 10 men have some form of color blindness, and this is going to be a sex-linked disorder. So if you take a look at this image here, I want you to figure out if you're able to see all the numbers that are on this image. If any of them are difficult for you to see, then you might have color blindness. So I'm going to let you guys pause the video and then take a second to take a look at the image and see if you guys are able to figure out what numbers are in each of these circles. Sickle cell anemia is going to be a disorder where there's going to be abnormal hemoglobin, which is going to be a protein in red blood cells, and it's basically going to warp these red blood cells. So these red blood cells are normally supposed to be able to bring oxygen to different parts of the body. They're supposed to be nice and smooth. They're supposed to be round. But in sickle cell anemia, they're going to be more of the sickled shape. And then what happens is they get stuck onto the blood vessels. They get stuck into different areas. So not only do you not get enough oxygen, but it causes a lot of pain in some of the joints. All right. So sickle cell is going to be a recessive trait, and it tends to be more common in African American or Mediterranean people. Cystic fibrosis, this is going to be a recessive autosomal disease. This is life-threatening, and what it does, it causes a very thick mucus to build up in different areas of the body. Very common areas are going to be like the lung or the digestive tract. This is going to be more common in Caucasian, of Northern Central European descent. 1 in 29 Americans carry the alleles, and the average lifespan in the U.S. is going to be 37. Because people usually die of complications. So with these people, they have just basically mucus buildup that's going to prevent them from getting enough oxygen and then being able to do certain things normally. Hemophilia. Okay, so hemophilia is going to be a bleeding disorder. And basically what happens is going to take a very long time for blood to clot. So normally when you get a cut, what's going to happen is your platelets are going to cause this clot to happen. That's why you get those different scabs. And it's going to prevent bleeding from happening or continuous bleeding from happening. For people who have hemophilia, they basically don't have this clotting agent, and then their body just continues to bleed. So with these people, very small cuts can be very life-threatening for these people. So this is going to be a sex-linked, okay? And treatment is going to involve injections, which is going to inject the missing clotting protein. The last disorder is going to be Huntington's disease, and this is an autosomal dominant disorder. And what happened is going to be deterioration of the brain that usually begins between the age of 30 and 40. There's going to be no cure, but medications are going to be given to kind of cope with the symptoms. People usually die 15 to 20 years after the onset of degeneration. So here is going to be your normal brain. Okay, so it's, there's lots of brain tissue. And then here in Huntington's disease, you can see that there's deterioration of that brain. So, just basic things like being able to move, being able to speak, being able to interpret things, being able to use your brain effectively is going to be limited.